Right. Good evening to all. Could you hear me? Rajay, could you hear me?
Yes, madam, I can hear you.
Good evening to all who joined the webinar organized by the Sri Lanka Medical Association in collaboration with the Doctors Cricket Sri Lanka and Sports and Exercise Medicine Unit Faculty of Medicine, Colombo, on should athletes be tested on their fitness. I'm very thankful to Dr. Rajiv Nirmalasingham of Doctor Sports for taking an interest and organizing this in collaboration with other two organizations. I mean, I must assure you that as the Sri Lanka Medical Association, we all the time come forward to promote sports among doctors. You know that how important exercise for the fitness as well as for non-communicable diseases. So it's part and parcel of medicine, and it's part or the responsibility of the Sri Lanka Medical Association to promote sports among doctors. So based on that basis, we all the time support the doctors cricket to engage and promote their, engagement, involvement with cricket. And I look forward to support of the doctors to promote more and more sports via the Sri Lanka Medical Association. So I think that the topic that you have selected today is timely, particularly because, in my personal opinion, it's not only for athletes. Nowadays, for majority of you who pass 30 needs fitness testing, because when I compare with my time, I know that many of you in day-to-day life do not come across situations where your fitness is tested in your day-to-day life. So by the time that you reach 30, it has become important for all to be concerned of your fitness and to continuously engage with physical activity to maintain fitness. But today, the topic is on should athletes be tested on their fitness, a discussion into the heavily debated topic of fitness testing of cricketers. I'm told that Dr. Chathuranga would be talking on the variant types of tests that would be important for variant types of sports and their benefits. And I know that Chathuranga, I have been knowing Chathuranga for more than 5 years now, and I know that you have selected the best possible available resource in this country. I know that he would do justice for this topic. Again, thanking for all who took an interest in organizing this webinar. Let me invite Dr. Rajiv Nirmalasingham to take over and to continue with the webinar as the moderator. And Rajiv, over to you.
Thank you very much for those valuable comments and thoughts, Adam. We appreciate your presence today despite your busy schedule. I hope the doctors will take this message pretty seriously to engage in sports and other activities and join hands with Sri Lankan Medical Association in this time. And also, we appreciate and applaud your efforts in combating COVID-19 these days. Good evening, everybody. Welcome to the webinar today, organized by Doctors Cricket Sri Lanka in collaboration with Sri Lankan Medical Association and Exercise and Sports Medicine Unit, Faculty of Medicine, University of Colombo. I'm Dr. Rajiv Nirmalasingham. I'm a consultant surgeon in Telipala Jaffna Hospital and also a member of Doctors Cricket Sri Lanka. Doctors Cricket Sri Lanka was established in early 2000 under the guidance of Professor Indika Karunatilaka, and it has grown in stature over the years. Special thanks to Lawyers Cricket Sri Lanka and few other professional bodies who have taken up sports pretty seriously. Today, we have an interesting topic. Should athletes be tested for fitness? It is a quite interesting and famous topic, discussed and debated among various forums, including the professional forums to academic forums. And also, it has a special interest among general public as well. Doctors Cricket Sri Lanka is part of Sri Lankan Medical Association, and we are a non-profit organization. It composed of a bunch of doctors who play a key role in cricket at various levels and show some interest in all sorts of sports. We don't have any conflict of interest in terms of sportsmen and women being tested for their fitness. Today, the aim of this session is to elaborate and open up the science and physiology about exercise and fitness, and also open up some knowledge regarding what are the tests available, what is fitness test, and how we can do this. Our aim is not here to criticize anybody who is doing the fitness test and not to tell them how it is supposed to be done. As you all know, in the modern days, the sports is evolving pretty fast. The dynamics of sports has changed. The complexity and the competence level is changing. And also, the profit making is also huge. So every sportsman and women demands a lot of techniques and skills in par with their fitness. When you talk about fitness, there is mental fitness and physical fitness. The mental fitness is the psychological aspect of fitness, where an elite athlete has to perform under different circumstances with so much of pressure. But in today's session, we will be focusing on physical fitness only. Physical fitness is paramount important for sports. For any women and men to excel in sports at a professional level, the physical fitness is benefit to perform at their best, to prevent them from their injuries, and to carry a sustainability and consistency. As you all know, we Sri Lankans are more fond of cricket. I'm sure the session will be more focused on cricket fitness and how these cricketers are being tested on fitness and the test which is available. So we got an interesting expert in this topic to talk about. In this today's agenda, we will have a session from that expert is Dr. Chathuranga Ranasinghe. He will take you through a few presentations, and then at the end of the presentation, there will be a question and answer session. We will try to take as much as possible your questions, so please send across all your comments and questions in your inbox. It's my privilege to introduce Dr. Chathuranga Ranasinghe. Dr. Chathuranga Ranasinghe is trained in UK Durham University, as well as Queensland University in Australia. He trained himself there to train and test athletes for their fitness. Currently, he is a senior lecturer and director of Exercise and Sports Medicine Unit, Faculty of Medicine, University of Colombo. He himself is an excellent sportsman. He captained the badminton team of University of Colombo in 2005 or 6, I think. And then he also the first cricket captain for the inaugural big match, which was played between Faculty of Medicine Colombo and Faculty of Medicine Peradeniya. I kindly invite Dr. Chathuranga Ranasinghe to take over the presentation. It's over to you, Dr. Chathuranga.
Good evening, everybody. Thank you very much, Dr. Rajiv, for that kind words. And thank you very much, Madam Dr. Padma Gunratna, President, the Sri Lanka Medical Association, for this opportunity and for your kind words. So, and also Doctors Cricket to initiate in this type of a work, which is timely. So let me share my slides. So in the next 30 minutes or so, I would take you through some of the interesting parameters when it comes to testing athletes. So at the onset, I'd like to state that I have no conflicts of interest regarding the material presented here. And the objectives of these couple of slides would be to identify different fitness demands in different sports, and also specifically on cricket and how the demands have changed over the years, and specific fitness parameters relevant to cricket. And then the interesting topic, why we should test athletes, or should we test athletes, and a couple of tests available which are more commonly used, and some of the comparisons between these tests. So since we are talking about athletes, who is an athlete? This sculpture, which is found in Greece, is almost 2,500 years old, shows a picture of an athlete. So it shows the strength, the endurance, the symmetry of a human body, state of control of a function, how the mind, body, and spirit is controlled to execute certain type of function. The anatomy is very much visible with control. So athlete is a person who has some and most of these features. In the ancient time, in Greece, where the Olympics, ancient Olympics originated, it is much more of a test of physical status to select who is the best and to show who is more powerful and skilled. But over the years, it has changed into a modern game, which is more extravagant. It's more global. It connects nations and continents. Around Olympics, there are other championships which draw in athletes, more recognition to athletes when it comes to social status, financial status. Basically, they are celebrities. So with these intensities, getting into sports, performing sports is much more than just showing off your physical status. So when it comes to sport, definitely these are skilled people. Definitely they are more fit people than the normal what we see day to day. So when you're performing at the highest level, these two features are very important, whether you're skilled, whether you're fit. So the demands of an elite athlete, number one would be the skill. Because if you are not skilled more than the other, you won't be representing your national team or your school team, because he or she is more skilled than the others to do a specific function. Then comes the physical fitness, which is paramount to keep on the skill going. And sometimes there are fitness-based sports, which sometimes the skill and fitness is combined together. Then comes the state of, as Dr. Rajiv mentioned, the psychological fitness to maintain over the years, winning, losing, and maintaining the fitness and skill level. So as you can see, the skill forms the basis of any elite athlete. And if you have the physical status on top of it, you can go on for a longer period. So when you have the basis as bread and butter, where the physical and skill comes in, most elite athletes maintain at high mental status level. You can see when they are not mentally sound, they lose, because normally these two are very much high in them, but at this level is where whether it is decided whether you win or lose. And your skill is mainly coming from your genes. Olympic athletes are decided by their parents. So I am focusing on physical fitness parameters. Now in sports science and medicine, you define certain parameters where you categorize fitness. So there are basic parameters which we call health related, and the other are skill related parameters. Now, cardiopulmonary fitness, that is a efficiency of your heart and lung and muscle to do a function. How long you can go on a staircase, how long you can run, which is the basis of most of our functions. Now it is considered as vital sign when even it comes to medicine, as Dr. Padma mentioned. And flexibility, your muscular strength and endurance, the body composition, how you are made out of. So for a lay person, how much of muscle and fat and bone you have in your body will define whether you are or not. So these are the basis of most skill and occupation related fitness. Your agility, that means the ability to move, cut across, go speed, change direction, the balance, the coordination, hand-eye coordination, the power, the speed, reaction time. Now these are, you see a lot in athletes. That's why they have speed, they have balance, they have agility. So these two factors are there to maintain what they are there today. So I will be mainly focusing on these basic parameters and also some of the skill related parameters. If you just think of what are needed in different sports. Now, if you see sports are different. There are different types of sports. So most of the sports needs basic fitness, but some need it in different composition according to the demand. So this person, I think you must have seen him, everybody knows him, that is Usain Bolt. That's the 100 and 200 meters world champion who holds the world record, runs 100 meters in less than 10 seconds. So his demands are mainly the anaerobic power, where you can speed up using without even using oxygen to generate energy and use it in his muscles. He has strength, he has power in his legs and core and arms. You can see his body. He has speed to expulse and create a massive force with his legs. So when it comes to an athlete like this is Mo Farah, this world champion marathoner. Now he doesn't look that big, right? He's very small, but he can run 32 kilometers around 2 hours, which he might not be able to do, right? So his demands are different. His demands are endurance, keep on going for a longer period of time, maintaining speed. So these are basic fitnesses where they need the cardiovascular endurance to do their sport. This person also seen all over the internet, Cristiano Ronaldo, one of the best footballers ever. Now his demands are different. Now he needs speed, he needs endurance also, and he needs to quickly cut across, quickly change direction. He needs coordination to kick. He needs specific accuracy to kick the ball to a goal. He needs strength and power. So he needs more than them sometimes when it comes to different parameters. Same with rugby, another popular sport. This is Jonah Lomu, one of the greats in rugby. Now he can run. He is almost 2 meters in height and 120 kilos, a big unit. Now he can run 100 meters in around 10 seconds, almost like an Olympian. So his demands are that he can hit the person, lift the person up and down while he's doing that. So his demands are more power-based and speed, endurance-based. Now there are other types of sports. Now recently we had our Olympics. One of our athletes represented Olympics, Niluka Karunaratne. Now what he needs, now badminton is one of the fastest games that we have. So they play shots about 1 shot per second, even 2 shots per second, like. So they need agility, flexibility, movement. Some matches go for hours, almost an hour. To maintain that sort of a strength, he needs a lot of endurance, flexibility, etc. Then things like gymnastics needs flexibility and balance. Now, when you look at these athletes need different types of fitness, health related plus skill related fitness. And if you come to something like shooting, it's mainly concentration and skill of shooting. So when you are testing a person or checking the demands, you should be aware of the demands of specific game and to see whether we are really testing them and improving them on those areas. So the topic today is cricket. So I just see whether cricket is skill or fitness or both. Now, at the beginning of the game, cricket, almost 140 years old, this is the English captain W.G. Grace. He's known to be one of the best cricketers at that time, one of the most technically sound, and people buy tickets just to come and see him play. At that time, it was mainly test cricket, which is played for about 5 days, right? Long years. And this is the Australian team who played the first cricket team, first match, test. So it was a 5-day game, long days, which the game is being played. After almost 100 years, came the one-day era where 50 over games are played. The game intensified, and then the playing increased. The popularity of the game increased, right? And then in 1996, where Sri Lanka won the World Cup, the game again intensified because of the high hitting of these two gentlemen here. So almost your total score was around 200 during the time of the normal one day, but they get runs around 260, 70 at that time. So the game intensified further. The intensity of the game, the amount of work, the running the person has to do, amount of shots he has to play increased. Then came in another, after 25, almost 40 years, almost I would say 30 years, the T20 era, where the game is now played. There are all these 3 formats are still there, but now the game is still further intensified. You have about 90 minutes of play for one side, and pretty intense. So over the years, we can see how the people have changed. They look more lean, more fit compared to the previous times. Of course, 1975, you have some fit people, you can see, but they are more skilled. But at the same time, you can see their format, their profile is changing. So the change of match intensity increased and the player profile changed. So it is not skill only anymore to play the game. So if you think of the matches played, the load on players over the years from 1980 to 2020 now, I've just taken this from Cricinfo. This is Sri Lanka from 1980 to 2021. These are the test ODs and T20s played. So over the years, you can say average per year, we play about 10 tests, 25 ODIs and 10 T20. These are only international matches, not franchise, not local matches, only those. So if you see the other countries, main countries, I have not put everybody, they also follow the same, but you can see India playing more one-days than maybe England, who plays more tests. So if you look an athlete who's representing a team, national team, in average, 90 to 100 days of international cricket in all 3 formats should be on the pitch. And this is in addition, you have the domestic and franchise tournaments, which are increasingly getting popular. The rest of the year, they are training. Since T20 is increasingly getting popular with these IPLs, CPLs, LPLs, etc. Now, tomorrow is another domestic tournament is starting. And also, there is a ha-ho that in 2028, possibility of incorporating into Olympics. So if included Olympics, there will be more countries playing the game. The training, the competition, the intensity, the workload will further increase. So what I'm trying to show you is the demands and the intensity of the game is quickly changing for the next 5 to 10 years. When you think of cricket, for the people who know cricket, and I think most of the Sri Lankans know it very well, there are 3 profiles of players. One is a batter. Now we call him batter because there are ladies who play cricket in the international arena. Initially, it was batsmen. And you have bowlers, like you have pace bowlers who deliver a ball almost 100 miles per hour. And you have spinners who spin the ball, and you have fielders, and you have, of course, the keeper. Now, let's see what are the demands of these specific three groups. If you think of a T20 game, which lasts for about 90 minutes per team, most of the fast bowlers and fielders have higher demands. If you take percentage wise, either they are walking, jogging, striding, or sprinting. So around 50% of the time, either they are jogging or running during time. And fielders are also the same, right? And batsmen, a bit less. But at the same time, all batsmen should be fielders also. So they will have these added demands on them. If you look at a bowler, you must have seen that normally he has a large run up. He runs almost about 20 to 30 meters, quickly starts up, then speeds up, jogs, speeds up, highly sprints, and with force deliver the ball. So he normally per over, he has to run 6 times. This is one of the fastest bowlers ever, Shoaib Akhtar. He runs more than 20 meters and he delivers the ball. Now his demands, because you see a lot of injuries in fast bowling because he does this over and over again. Now for T20, it's only 4 overs. For a one day, it's 10 overs. For a test match, it can be even 30, 40 overs, right? So because of that, the demands, even some countries like Australia has put some ranges for young cricketers that the amount of bowling that they should do because of the injury rates. So he is very much intense type of a athlete when it comes to bowling. So there's a research done analyzing Big Bash tournament with the GPS monitoring, how much they do. A fast bowler normally runs or walks around 6.5 kilometers per match, right? And that is around 4.4 kilometers walking, rest of the time, about 2 kilometers speeding, running, jogging. Okay. If you think of a test match, it might be about 25 to 30 kilometers of running, walking, jogging, and one day would be the same. So these are the demands that even we think that they are just sitting down and doing nothing, there is increased demand on them. When it comes to batting, of course, it's hand-eye coordination and timing and rhythm. But at the same time, you need explosive power when it comes to the shorter format of the game, right? To hit ball over the ground, sixers, fours. So you need a lot of core strength, a lot of upper body and lower body strength to hit the ball. And on top of that, you have to run. You have to run about 20 meters in between wickets, right? And which is an added burden. And you are running not just like Usain Bolt with the spike, but you are running with a bat and pads and helmets on. So sometimes it's seen about 20 meters, these athletes cover in less than 3 to 4 seconds. That's almost like a startup of an Olympic sprinter or the first 20 meters. So it's actually very fast, right? But you might think you can hit sixers and fours and take runs. But now this is Virat Kohli. He's at the top in the game at the moment, especially in the one-day format. Now he has scored in T20s average of 52.6 in a strike rate of almost 140. Now his runs by fours and sixers are, it's about 50% of his scoring with the highest strike rate. Rest of the runs are taken by running, ones, twos, and threes. So if you want to get a 50, 25 average or more, you have to run. So that is a demand of a batsman. You should be able to explosively run, decelerate, stop, turn back, which takes a lot of energy. It's not like running forward straight or change in direction. You have to turn 360 back and run. So that takes a lot of energy. The other format is fielding, of course, you need a lot of flexibility, agility, a lot of skills to do fielding. Now, fielding has become very important now in the game because those are the things really matter now. So you speed, accelerate, decelerate, sometimes you jump, you swing yourself around, you need a lot of endurance. So fielding, every athlete should be doing. When you're a batsman or a bowler, you should be doing this. So when you think of this big bash analysis, the fast bowlers about 6.5 kilometers, fielders almost 6 kilometers of running. This is only about 75 to 90 minutes. And batsmen, less, but they also have to field. So I'm not trying to tell that cricket is the most intense game, because there are other forms like football, which is more intense, right? Need a lot of fitness to stay on the game. Now, in a football, in a match, which lasts for about 90 minutes, 2 halves, whereas T20 crickets, it's about 180 minutes, 90 minutes each half. Now, this is about 40. He covers about 9 to 14 kilometers, whereas it's almost like half of cricket, right? Now, this person would play about these intense matches, about 60 to 80 matches per year, whereas the cricket, it will be around 90 to 100 now. It's increasing. Walking and running is similar. Sprinting is also a bit similar, what they do. And every minute, 2 minutes, a footballer has to sprint about 30 meters, 2 to 4 seconds, which is similar to a batsman if it is in the intense form. The most difficult thing would be change in direction because of the agility. You change direction quickly compared to a bowler or a fielder. The fielder takes a lot of changes in direction, but compared to a footballer, it is less. So what I'm trying to show is that cricket, the intensity is increasing, but it is not as big as other forms. So the question, should athletes be tested on these fitness that we are talking about? Why should they be tested? Or they can just go on playing by the ear. Now, in my opinion, it is yes. And we'll tell why it is yes. So is it fitness or skill which matters? Obviously, with the increasing intensity of the game, with the increasing competition, the skilled athletes are selected to a team. To get selected, you need both skill. I mean, if you are not skilled, you can't be on that scene. But the next level is you need fitness to maintain. So the criteria is still not very much defined, but to get selected, you need the skill. You need the physical fitness, as I mentioned before. You need the skill, but the physical fitness and mental fitness comes next. The other thing is, this is a global game now. You know where are the levels of skills of other athletes. You can see that. But sometimes you don't know what are their physical status. To know where you are in the world on physical status and how long you can go on is important to an athlete. The other important thing is, just like we test blood for, say, for diabetes, we test blood to have a baseline, whether to see where we are. Then we know whether we have to improve it or whether we have to take drugs if we are going into a diabetic state. So likewise, if you have a baseline, you know how to improve. So if you don't have a baseline in international standards, athletes can't move to the next level going up here. They can have their skill, but they don't know where they are here. Other important thing is, now since the format is changing, a lot of money is coming in, clubs, franchise are coming in. So it's an investment decision. To select it to a team, the athlete, we should know whether he can stand for 2 years or 3 years or 5 years in the team. So it's an investment. If he gets injured in the middle, that can be a loss to the whole plan. So fitness comes there also. So as I told you, before you win a game or not, the athlete should be on the pitch. Keeping him on the pitch at the highest level, you need fitness. So for that, you need to test it and to know where they are in the international level. Okay, so fitness testing is where, as I told you, there are all these parameters. We have these basic parameters. All these parameters have specific tests, all these. but we will mainly focus on the basis of everything, which is the cardiopulmonary fitness testing. So what is cardiopulmonary fitness? It is a criterion measure that we taken as VO2 max or VO2 peak. That is the amount of oxygen in the outside that we can use inside our body through our muscles, and how efficiently we can use that. How many milliliter of oxygen we can use for a unit time of our muscle to create energy and do. So that is called VO2 max. Now what happens is, when we are doing exercise, we increase oxygen, expel carbon dioxide. We do that for a longer period. We increase with the intensity of exercise. If we are going on running around the ground, your intensity increases, and there's a maximum level we call VO2 max that we can use. So each person is different depending on their genetics, depending on their training. So sometimes you can't reach the VO2 max because you get exhausted before that. So you call it VO2 peak somewhere here. So that is the marker of cardiovascular engine, just like milligrams per deciliter for sugar. This is the VO2 max is the standard criterion. Now, one of the highest tested so far in the world is one of these cyclists who are very good on endurance. 97, almost 100 milliliters per kilogram body weight. Now, that is very high. Now, normally we have tested here in Sri Lanka, one of the highest would be around 52, which I have tested. And average male active, very active average male would be around 30, 35. So you can see the range of the persons and these elite athletes and go on. So this is an elite athlete on a national level. So it's different. A cricketer or a badminton player might not need this much of endurance, where you Tour de France, which goes for hundreds kilometers cycling. So what are the tests available? We have these high-tech tests available. Those are called gold standard, checking the endurance or the fitness. And you have field-based tests. This field-based test is what you see all the time. What they do is they indirectly measure the VO2 max and gives a range. Okay, this is your level, right? So this high-tech exercise testing is done in the world. Now, reason this is a Cristiano Ronaldo. After his lockdown, he came down and do a basic test to see where his fitness is and then to improve. When people are going into contracts, like recently, Lionel Messi, who changed from Barcelona into Paris, did the test. And so just to see as a contract where the athlete, or even at this level, is one of the topmost footballers in the world, but still the club tests him to see where they are. So that's the level of testing going in the world. But it depends on money, it depends on setting, equipments available, training personnel available. There are a lot of factors, but it is happening. And fortunately, we also were able to do one of these tests in Sri Lanka, and we have been doing for the last 1 or 2 years. Now, I have taken this information from this athlete with his consent. Now, just to ask for an educational purpose to show how the testing could be used to improvement. You must have heard about Kalinga Kumarage. He's the national champion 200 and 400 meters. He recently in India, he ran before Olympics his personal best, and almost 4th personal best in Sri Lankan as a Sri Lankan. So in this athlete in January, we did a cardiopulmonary exercise testing because he had some problems of getting on with his race, some improvements. So he came up and we did that test, and then analysis was done in Sri Lanka. So then we found some areas for improvement. So changes of training done, nutrition input was given, Professor Ranil Javadana was involved, changes on biomechanics was done. And then 6 months of training with his own coach and own setup, and some input from us. In June, in India, he ran his personal best, one of the best in. So his record was 55.99, which came down to 45.72. So still is in the process. So likewise, you can use these tests to improve people. And that's the other forms that we can be done. So those are the high-tech equipment, but high-tech equipment can't be used in everywhere. So we have field tests where you can predict the VO2 max from different ways. Now you have walking test. Now in 6-minute walk test, most of the doctors know because we do that in patients, and 3-minute step test. Likewise, depending on their ability, you can do tests and you can have nomograms to show, okay, this is the level that you are. But mostly spoken in the field are tests like this, which is called 20-meter shuttle run test, which is called bleep test, yo-yo test, which is widely done in athletes. Now this new test has come, 2-kilometer run. We'll discuss about that also. Now yo-yo intermittent recovery test is an athlete runs in a 20-meter direction forward and backward, and he recovers for about 5 seconds and runs again. So like that, with time, there's a bleep going on, a signal going on. With time, the intensity or the speed he has to run increases, right? So towards the end, we are calling levels. Those levels, when you go high up, is really exhaustive. I'll try to show you one of the videos that I just downloaded. Now this is, let me share. If you can see this, this is the yo-yo test. So this is done, this video is done in the English cricket team. So you run forward and backward, right? And he recovers. So you run forward and backwards. So good thing about this is this can be done in a hall. So these, you have to cross these levels at a given time. If you don't cross it properly, you are disqualified. So this is a very exhaustive exercise. Normally you say about, if you go into about 17 levels, and you can cheat also, you can see people can cheat like that, you know. So towards the end, it is getting very exhaustive and the speed increases that you have to run. Okay, so that's yo-yo test, and it is widely done all over the world for so many years now. And you can see the running speed increases, the duration increases. So we will try to compare some of the tests with this. So that's an incremental test, which is a bit similar to the CPET, which is an incremental test. So you can test from rest up to the maximum level of exhaustion. Right? And then actually before yo-yo, it was this bleep test, which is very similar, but it didn't have any recovery time. So yo-yo test is a bit similar to cricket, because even in a fast bowler who runs, delivers, and he recovers, again runs, delivers, recovers. Even a batsman hits, runs 20 meters, recovers. So most of the activities in athleticism, you have about 20 to 30 minutes runs, meter runs. But this is very difficult because it doesn't have any rest, but it increases in intensity. The flat runs, over the years, there was one more, I would say, popular test was 2.4 kilometer or 1.15 Cooper run. Now these were done, originated in the US, where they are testing the Navy SEALs on their fitness. So what you have to do is you have to just run as much as fast as possible, on 2.4 kilometers. And according to the timing, you have been given with a good, poor, excellent, or superior. So you don't have much range here, but you run as far as possible to finish it off. So I think that is 2 kilometer run is which similar to that. The difference is that it is not incremental. The athlete can decide which speed that you have to run, right? Whether in the first phase you have to run fast, the second phase you have to run slow, right? But all these are indirect tests which we can say, okay, this, if you are on that level, we can predict your VO2 max maybe around this area, this level. So according to the gold standard of cardiopulmonary exercise testing, if you think what is a good CV test, but definitely depends on what you are testing them for. Whether you are testing for that specific sport, or whether you are testing for them to be a runner, or testing for them to be a batsman, etc. So it depends on what you are measuring. It's like HbA1c and a fasting blood sugar. You check sugar, but the purpose is different. So if you can measure VO2 directly, yes, but field test, you can't measure that. If you can replicate the demand of this, very good. Like if it is really demand, if you can check, like for a badminton player, if you want to run 2 kilometers, there it doesn't reflect of what the demands that he needs to have. And if it is incremental, that means the whole physiology is getting slowly picked up to a level where you can give your maximum. So rest to max fitness, you have more data. And the test should be there to give an idea to prove. Now, incremental test will give you an idea. Okay, if you have level 15, you have to go for the level 17. It has some idea how you can go on. Compared to others, if you have to just run a race and say, if you run 2 kilometers in 8.5, and if you run 2 kilometers in 7.9, what does it really mean? You don't know. The other thing is you should not be able to cheat. You can cheat within these tests. As you saw in that video, you can't, maybe you might not run whole 20 meters, but just turn and come, the person might not pick it up. So looking at the comparison of these three tests, now intensity wise, it's incremental yo-yo, 2 kilometers a flat race, but it's very fast, it's very exhaustive. Normally you say cutoff of 17 to 18, 13 to 14 in bleep test, because it's hard, it doesn't have any recovery time. And 2 kilometer, it came recently, especially in the Indian team, and now it is getting a bit popular. And it's about less than 8.3 for a batsman and a fielder, less than 8.15 for a bowler. So if you just stretch out the whole test, the yo-yo, the amount of distance covered here from 400 meters, 800 meters, even though you run shuttles, the amount of distance calculated, you can see yo-yo will pick up from lower stage into much more faster stages. Right, level 17 is almost, you have run about 2.5 kilometers, and towards the end, it becomes very fast, right? You run for around 12 minutes. And when it comes 2 kilometer run, if you maintain about 15 kilometers from the beginning, you can just finish off within this time, right? And you run for about 8 minutes. But it's very difficult because from the beginning, you have to pick it up and run. If you are not trained for that properly, because it's not warming up, is not there as a test, it's just like a race. So there is a possibility of that you can get injured, but it's a very hard test compared to this. But you can see the speeds are very much higher when it comes to yo-yo. Bleep test also similar. It also increases 0.5 kilometers per hour, like, and it reaches this speed actually very late, the very late stages in 30, right? But you run for more time when it comes to yo-yo and bleep. Yo-yo doesn't just have recovery, other two doesn't have recovery. Yo-yo and bleep are more specific for cricket, I would say. And problems prone for injury. To perform the yo-yo test, you need bit technical support, but 2 kilometer run is very easy to do. You just let them run and check the timing. So these are the comparisons. Nothing is better than the other, but depending on what you want, you can, because you select people to the next level. So these are the basic parameters we were talking about. The other important parameter is body composition. Now, body composition is, in our human body, we are made out of mainly muscle, fat, and bone, right? But I'm just going in lay terms. So you have these in different compositions. Sometimes normally you have essential fat and fat deposition. If you have more fat in the body, you carry more fat, so your agility, your speed, duration might change, especially when it comes to athlete. But when it comes to people, it is much more when it comes to athletes, it's much more speed, not health. So, but you can see different athletes have different body compositions, body parameters. You can't see there's a perfect athlete, because depending on different formats they have, their composition changes. So you do skin folds as a field measure, that you take a piece of skin and do this measure, and you can identify what's the amount of fat. This is a caliper. You take this called skin fold test, and you take in different places of the body and make a calculation. Okay, this is the amount of fat that you might be having. So it's a good for a baseline measure, but it changes from population to population, right? I will tell you that why, and it depends on the person it takes it also. Now there are new formats have come in, like DEXA scan, which really can scan the whole body and see where the fat percentages are. But this is much more simple and easy to do in larger groups. So body fat in athletes, you say if you have 17 to 14 and 14 to 20 male, that is the highest level that an athlete can achieve. So if you have less fat, you have more muscle, you can do more function. But it can increase with age, the fat percentage in a normal and even an athlete, right? And these are Caucasian data. The problem is, as South Asians, we have more fat. So because of that, these data might not be that right? Because now if you take these two gentlemen, these are two professors from India and one from England, I think. And they are both, BMIs are same, their weights are same, but their fat is vastly different, because South Asians, we have more fat. So more muscle is better to do its function, right? But sometimes in some sports, fat is important, right? So you can test all these parameters. You can test strength also, right? And give an idea about that. You can test various agilities, various powers, speed, sprints. You can define test batteries to depending on the different demands of the game. So the final conclusion of what I'm trying to say is that testing is very good, but as I told, it comes with the skill. To maintain the skill, we have to improve fitness. It's not the other way around. So we have won with a lot of talent, because we had a lot of unorthodox talent in the country who are really made the change of the game. And it's better to have a battery of tests, grade athletes, and improve them accordingly. So, and the other thing is, especially the younger athletes, depending on the intensity and the change of the game, they have to think a lot on fitness plus skill. So at the end of the day, skill make the basis, but the physical level keeps you going. So I think I just went over time. Thank you very much. Over to you, Rajiv.
Thank you very much, Dr. Chathuranga. It was pretty descriptive and very interesting topic presentation as well. I think everybody must have enjoyed that presentation. I'm getting more and more questions in the inbox, but we don't have time to answer all the questions. We try to take it as much as possible. Without wasting time, let's go on with the questions, Dr. Chathuranga. The first question is asked by Dr. Kasun Karunaratne. He's asking, is it like one screening test for all, or you want to test, if at all, if you're testing somebody at a multiple level? So in other words, when we do exams, you have MCQs, SCQs, and Vivas, and it's a stage process. So do you agree on that point, or you think what should be the way forward?
I also agree on that. Like, why you are testing, one thing could be to select to a squad. But if you are selected to a squad, then there should be different levels to improve them. So at those time levels also you could be tested. For an example, if you are very young athletes in school, their form of or the approach of testing is different to the national team. So test will always have some sort of a preparation. So like if you're having A levels, you prepare for 2 years. If you are sitting your finals, you prepare for 5 years. So you should know what are the demands of the test, also the athletes. It's not a haphazard thing. So depending on the demands of the game, you can stratify the levels. So you can select, but also you can test to improve. So when you're selected, you need to have basic test. But as I told you, body composition, strength, and endurance comes very importantly when it comes to and power when it comes to bowlers and batsmen. So depending on that, you can demand or define types of tests. But it's an evolving field. As I told you, it all depends, and stratification is important.
I'll try to take on the next question, Dr. Chathuranga. I think it's a bit of a question asked at multiple levels, saying that for skill and experience, do we give sort of allowance? I think I will elaborate on this question. There was a time like, when in the 1996, when Aravind and then you have Guru Singh playing, and then you have young chaps like Chaminda Vaz and Muralidharan at that time. And then in the early 2000, when Sri Lankan cricket team was doing really good, you have guys like Sanat Jayasuriya and Muralidharan, and then you have sort of guys like Mahela, Sangakkara, and then you also had Angelo Matthews and Chandimal. So the experience that Sanat Jayasuriya and Murali carried is 15 years, and their performance is quite massive compared to the young guys as well. So what they want to know is, then also there was a little bit of controversy about the new teammates as well, that, what the question is actually, when you have a very talented guy who's an experienced guy, where cricket is more towards skills and experience, do we give a little bit of allowance for these guys, or it's like one size for all?
Yeah, I mean, that's quite an interesting question. I would say I will answer that on a science base, not on an administrative point, because when you're selecting athletes, there's a whole lot of other things that you consider, as you mentioned, like, their experience, their techniques, their decisions on the game, which is important for specific tournaments. So all those factors come in. But why we test is what is important. We talk as scientists or doctors that why we test is to see whether an athlete is on a specific level that they should be. So, and that thing is whether that person can sustain for a period of time. That is the basis of that. So depending on that, initially when you are deciding on these tests, the administrators and the scientists, everybody have to get together and decide on that. And this is what we should do. And one way out is that you can grade players not only on one parameter, but with different parameters. Like, I think there's already grading is there on athletes, especially in cricket, where there's A, B, or C. So you can get these physical fitness parameters also into those gradings. So if you say badminton, you have high level of athletes who are at the top in the world, who are given buys even in Olympics, like they are given exempted to participate. So likewise, if you have a grading from their experience, their skill, their statistics, plus their fitness, and then you can think of the highest athletes might given a chance like that. But that's not, as a doctor, I can't say that, but that's an administrative decision.
Yeah, thank you, Dr. Chathuranga, for that answer. I think, as you said, it's most likely a combined decision, I guess, with the selectors and fitness and conditioning coach and the captain and who are the administrative. Then we will try to take one more question. We are running out of time. I will not ask any administrative questions straight away. Go to the CPET. What I learned about CPET is when I was doing my MD Part 2, CPET is done for heart transplant. If you just to see whether if you're fit enough, sometimes, you know, CPET is there to, you know, like a pre-op assessment for a lot of complex surgeries as well. So, how, you know, can you please elaborate a little more on CPET, whether it's available, it's widely available in this country, whether it's available for all these light top athletes, whichever the sports they are in, and also whether, you know, how do you interpret a little bit more on that, please?
Yeah, that's quite interesting because this technology was there for so long, more than almost 50 years, and it is being used even in patients for the last 20 years. And the availability, of course, still we don't have it in the state sector, but it is there in the private sector. And what it does is that you can, from rest to the maximum exhaustion, you can put a person and ask him to ride on a bike, where an amount of workload, amount of resistance given incrementally. That could be done on a treadmill also. So while he's going from rest to this maximum level, his oxygen consumption, carbon dioxide usage, his 12-lead ECG, spirometry, how the capnography, oxygen saturation, blood pressure, everything is monitored. So you have that in the graph. So then how you can test, especially when it comes to athletes and even pre-op assessment, there is a place that we call it anaerobic threshold, where you build lactic acid in your muscle when you're exercising, and at a point the lactic acid comes out into the blood, and it gets buffered by the bicarbonate and expels as carbon dioxide. There's a point that this thing doesn't happen very quickly, and it starts building up, and the body can't really buffer the bicarbonate, buffer the acid. Then that's the time you feel really difficult, that you feel that you can't go on anymore. So if you know that level, with exercise around that heart rate, you can improve people, and that is a good measure. It's a number. You can have a number. It's not like, you know, running this much or running this level. You have an actual number to see where the person in the world, when it comes to how many oxygen he can use compared to the international levels. So then sometimes we might think middle distance running is better to Sri Lanka than going for a short distance. So I mean, like that, you can make some decisions where we are. There are ranges that is given for the national, international level. So you can do that. When it comes to long term, like surgery, major surgery, a lot of the perioperative decisions could be taken depending on the fitness of the athlete, and you can do prehabilitation to optimize the person before surgery, which will reduce the post-operative complications. And for some diagnoses like cardiac exercise-induced asthma, things like that, this gadget has a lot of features that we can do. But when it comes to athletes, now we have done for Sri Lanka cricket athletes and badminton, track and field, some, and we see some of the changes as the example I showed you, that we can improve them. So that's what it is now at the moment.
Thank you very much, Dr. Chathuranga. I hope more people get access to CPET and they try to assess fitness more objectively. I think we have to wind up now. We are running out of time. Already we have gone past some time as well. This topic is very interesting. We can talk for hours and hours. And actually, I had so many questions, but you know, I can't ask all those questions. Thank you very much again, Dr. Chathuranga Ranasinghe, for your descriptive presentation and taking on questions. At this time, I want to extend my sincere gratitude to the President of Sri Lankan Medical Association, Padma Gunaratne, and a colleague of mine, Dr. Sachin Colombo, who is behind the scene helping me out to run this webinar successfully, and also the members of Doctors Cricket Sri Lanka as well. And also, I hope you all stay home, stick to the guidelines, which is coming on a daily basis from the health sector, and stay away from COVID and keep yourself safe and all your loved ones. Thank you very much for watching. We will meet again when we have another interesting topic. Thank you very much.